Hello friends, the topic for today's discussion is something which is very commonly asked by patients is the cost of the hernia surgery. The cost of the surgery may vary between 40 to 50,000 in some patients to maybe more than 2 to 2.5 lakhs in some hernias. Therefore, patients commonly get confused why this wide range of the cost of a hernia surgery. And this range varies within the same hospital and sometimes also between different hospitals. So today let us discuss what are the factors that determine the cost of the hernia surgery. The first and a very important factor that determines the cost is the type of procedure that is being performed. And by type of procedure I mean it may range from open surgery to laparoscopic surgery to sometimes robotic surgery. And therefore it is very important to understand that open surgery may be done in a routine setup, a laparoscopic or a robotic surgery may require a higher or a better setup. Therefore, a setup in which the surgery is being performed and the setup which is required for the surgery definitely and may primarily determine the cost of the surgery, which may be open, laparoscopic or robotic. The second and another important factor is the type of hernia that is being operated. By type of hernia, I mean it may be a groin hernia, which is an inguinal hernia. It may be a small paraumbilical or a belly button hernia. It may be an incisional hernia or a large hernia in which the intestine, most of it has come out through the abdomen through a previous surgery. The range of the hernias may determine the type of mesh which is used, which may vary from a routine mesh to a larger mesh. It may require additional setup or maybe require post-operative supportive care in some larger hernias. It may also require additional procedures like complex hernias may require component separation, may require abdominal wall reconstruction, which is done in case of larger hernias. Therefore, the type of hernia in which the surgery is being performed also determines the overall cost of the surgery. The third important factor is the type of mesh which is being used. Routinely in case of groin hernias, the mesh which we use is a polypropylene mesh, which is a routine mesh and may cost anywhere between 3 to 4,000 rupees. However, in case of laparoscopic surgery for a ventral hernia or a belly button or an incisional hernia, we commonly use a composite mesh. The composite mesh is usually a double layer mesh in which there is a non-sticky layer which prevents the intestine to get adhered to the mesh. Such meshes cost almost 8 to 10 times that of the routine mesh. Therefore, definitely the cost of the total surgery depends on the quality or the type of mesh which is being used for the specific hernias. Recently, we have also used a 3D mesh which is used for a groin hernia, the cost of which is almost twice or thrice that of the routine polypropylene mesh. Such 3D meshes supposedly have better qualities which give better comfort to the patient after the surgeries. The fourth point which we have to understand about the hernias or which determines the cost of the hernias is the simple or whether it has become complicated. And by complicated I mean the hernias which has become irreducible, that means it has not gone in, or hernias that has become obstructed, that is the intestine has obstructed within the hernia, or the hernias in which it has become strangulated, maybe the intestine has become gangrenous. Such hernias may require an emergency setup or may require an emergency surgery, definitely may require additional procedures, for example the intestine may be removed, or may require post-operative care which may require an ICU setting. Therefore, definitely for a simple hernia may require a routine care, the cost definitely decreases. In case of emergency care or an emergency surgery, the cost definitely increases because of the post-operative care, post-operative follow-up, or may require a supportive care. So we have to consider the type of hernia, which may be a complicated hernia or a simple hernia, which may determine the cost of the surgery. The fifth and another very important point is the patient comorbidities. We may have a patient who is young, may come in for a hernia surgery in the morning and may get discharged the next day after the surgery. However, on the other hand, we may have an elderly patient, maybe 70-year-old or a 60-year-old patient, who may have diabetes, who may have hypertension, who may have cardiac disease, or maybe any other comorbidities, and may require additional care or a post-operative care. Such patients may require a post-operative ICU monitoring in some cases after the surgery. Therefore, definitely patient comorbidities affect the overall package of the hernia surgery in such cases. So we must understand that hernia surgery cannot be defined as a single entity. There are various types of hernias, which may be an inguinal hernia, which may be a belly button or a paraumbilical hernia. It may be a large incisional hernia. And depending on the type of mesh which is used, the setup in which surgery is being performed, maybe additional procedures which is being performed, or in case of patient comorbidities, the total cost of the hernia surgery may widely vary. Thank you.